My name is Vohra. I'm the interim health officer for Fresno County Department of Public Health. So the bottom line about the vaccines is that they're very safe and extremely effective. I don't use this term lightly. They are miracle drugs. No one expected them to work as well as they do. People expected maybe like a 70% success rate. The vaccine success rate is more than 95%. What I like to say is this is our bridge to normal. And how long this bridge is really depends on how fast we can get everybody vaccinated. This could be, over in a couple of weeks. It could take the next 6 months or longer, depending on what people choose to do in terms of getting themselves vaccinated. It really does come down to that individual choice of making that decision and going to go get your vaccine. And so it's really up to all of us to protect each other and up to all of us to say, my community is worth it, my family is worth it, my normal life is worth it for me to get this vaccine. Do your homework. We want you to be well informed. We want you to know exactly what this product is, but I stand by it. As a doctor, a physician, a scientist, I really stand by this vaccine product, and I know that it's safe and effective, and I want everyone to have that same understanding about the vaccine and feel really confident that they're doing the right thing by getting it. We still have about 200,000 people that we're trying to get to say, you're eligible, there's a vaccine available right in your neighborhood. We're optimistic that if we keep working as hard as we have, that we will meet that goal in the next couple of months. And that will feel really good because that means that now the virus just can't attack our community. Like, we really have put up this shield. I think what's going on now is the people that were ready for the vaccine, the early adopters, they rushed the vaccination sites and they went ahead and got the vaccine. Now we're working with the people that may be on the fence, maybe they need a little bit more convincing, maybe they have specific questions that they just don't see answered on all of the internet and etc. And they really need to have that one-on-one conversation with a trusted physician or a nurse or an organization that they trust. Every time we have a conversation and we expand understanding, we know that that's eventually going to lead to vaccination. Because if you understood this disease the way that the doctors and the experts understand it, you would be rushing to get that vaccination today. What we understand from this virus is that it does afflict people more than once, that the second infection could be worse than the first infection. That's why we just can't trust the immune response as the best shield. We really want that vaccine to be a better guarantee that that person will stay safe. And so that's where the variants are creating the headlines, is that we're really worried that if this virus goes unchecked in terms of the number of people that's infecting, the more it mutates, the more it replicates, the more chances that we're gonna create a variant that will become a problem. Once we stop this virus from finding its next host, we've really stopped this cycle of creating variants. And that's where the vaccines really come in, is when you get vaccinated, you've basically put a stop to that virus having the opportunity to create a variant inside you and pass it on to someone else. So when we hear, I've already had COVID, so I don't need the vaccine, I wish it was that simple. Just because you've had COVID, your body may have had an immune response, but your body's immune response may not be that strong. What the vaccines do is they guarantee that you have a strong immune response. So the next time your body sees this virus, it will definitely be able to defend itself. Just because you've had COVID before or tested positive for COVID, that's really not the best guarantee that you won't catch COVID again. And we know that that happens. So don't just trust the fact that you've had COVID before as an excuse to not get the vaccine. This has been a big learning curve for everyone in our county. Here in Fresno, we know that we've had over 101,000 people with the COVID diagnosis, just over 1,600 fatalities, and many, many more people who are hospitalized. Regardless of if you yourself got COVID or if you knew someone who had COVID, this has affected your life in a profound way. This is something we are all going to remember. We're getting more and more people vaccinated. And that is really a key layer of protection that's going to last. So that's really what it's all about, is making sure that we continue that progress. Decrease the numbers in terms of the COVID infections, increase the number of people that are vaccinated so we can continue to protect as many people as possible.